with us today. This is such an important topic, and I'm so thankful that Chairman Casey has decided to make this one of our priorities for this day. Without any question, you think about the fact that we have 46 million Americans today over the age of 65 living in the U.S., and just a few years from now, by the year 2050, that number will go from 46 million to around 90 million Americans. That is astounding growth that we should anticipate. By 2030, 1 in 5 Americans is projected to be 65 years or older. Nearly 90% of our seniors want to stay in their own homes as they age. To do this, seniors often turn to the support of their family members. And when I say that, I'm going to talk about how 44 million Americans provide every year around 37 billion hours, B as in boy, billion hours of assistance to family members. That to me is astounding. And it's a number for us to digest, but it's really hard to understand how important staying in your own home is, and the cost, maybe not just financial costs, but the human cost of providing that care at 37 billion hours a year. Family caregivers provide over 75% of caregiving here in the United States. That is a significant investment into our loved ones, and it's an important investment, and one that we should take a look at and find ways to make that support better. The Build Back Better proposal relies almost exclusively on funding long-term care through Medicaid. And that path, of course, is going to be quite challenging for so many families. The qualifications for Medicaid is significantly a hard threshold to cross over, which requires you to eliminate most of your resources. So that means that we need to look for other solutions. A better path forward would invest significant funding in a push for a self-directed care approach. This would give caregivers and recipients the means to make informed decisions about the services they need while providing resources to do so. Last June, I released a report expanding opportunities for older Americans, self-directed home and community-based services. So we looked for solutions in the report so that we could understand and appreciate what actually would be beneficial for families providing those 37 billion hours on an annual basis. And some of the solutions that we talked about was encouraging state Medicaid programs to establish self-directed care options. In addition to that, growing the long-term care insurance market. This is a critical piece. The earlier you purchase this insurance coverage, the cheaper it is and the longer it will last for most American families. Empowering the nation's volunteer army of 53 million family caregivers through sustainable funding that will improve conditions for caregivers while enhancing service quality. I've been around amazing caregivers all of my life, frankly. My mother is a nurse's assistant. She's in her 49th year of full-time employment providing care. She loves what she does so much so that it is, in fact, her mission. And so understanding and appreciating firsthand the struggles, the challenges, and the rewards of caregiving is undeniable in the household that I grew up in. And frankly, as I see my mother on the weekends when I'm back in town, she talks about how important it is for us to address this issue. It's one of the reasons why, Chairman Casey, I'm so thankful that we are having the hearing that we are today.
Ranking Member Scott, thanks very much for your opening statement. Now we'll introduce our witnesses. The order we had it in, Ranking Member Scott, is you would do the first introduction. Is that correct?
Yes, sir.
Okay.
My first, thank you, Chairman. Last month, we held a hearing on how to improve care experience for people enrolled both in Medicare and Medicaid. We call this the dual eligibles, and this is such an important part of the folks that we're talking about today are those folks who are dual eligible for both Medicaid and Medicare. We heard from a witness representing South Carolina's Department of Health and Human Services. She described consolidating 10 Medicaid home and community-based services over 5 years. Too many waivers create confusion and administrative burden for both patients and providers. Our witness today has witnessed an important report describing how Congress can help states avoid this unnecessary complexity. Lisa, I'm going to butcher your last name. Lisa Harutyan is an associate director for the Bipartisan Policy Center Health Program. She is an expert on Medicaid policy issues, including long-term care and home and community-based services. Lisa is responsible for managing BPC's portfolio of work on long-term care, chronic care, integrating care for dual eligible beneficiaries, and other issues impacting individuals with complex needs. Lisa has been with BPC for almost 3 years. She previously worked for Virginia State's Medicaid agency, where she researched and analyzed issues impacting the Medicaid program. Lisa holds a Juris Doctor, a Master's of Social Work degree, and is a member of the Virginia State Bar. In her testimony, we will hear Lisa explain the Bipartisan Policy Center's proposal to make it easier for states to streamline and simplify these home and community-based service authorities. We look forward to hearing your testimony, and I apologize for mispronouncing your last name.